Classic ketogenic diet as a therapeutic approach for drug-resistant epilepsy. For a long time, the ketogenic diet, KD, has been used as a treatment for drug-resistant epilepsy. It's a diet that's high in fat, moderate in protein and low in carbohydrates. In this video, we'll go over the classic ketogenic diet as a treatment for epilepsy. Wilder described classic ketogenic diet as the most commonly used therapeutic diet in drug-resistant epilepsy treatment in 1921. Long-chain triglycerides, LCT, derived from common foods make up the majority of the fat in this diet, which typically consist of 80% of calories from fat, 15% from protein, and 5% from carbs. In a review study by Lefevre et al., results showed that 56% of drug-resistant epilepsy children under classic ketogenic diet gained more than 50% reductions in seizures, and 32% of drug-resistant epilepsy children under classic ketogenic diet gained more than 90% reductions in seizures. Furthermore, 16% of the patients were seizure-free. Despite the fact that ketogenic diet has been shown to be as good as or better than any of the newer anticonvulsant drugs in controlling epileptic seizures. This therapeutic regimen can cause complications such as hypocalcemia, kidney stones, hyperuricemia, dyslipidemia, metabolic acidosis, and gastrointestinal issues such as diarrhea, constipation, and vomiting. The initial hospitalization of the patients may be beneficial for the start of the diet and adaptation. The diet should be calculated by an expert dietitian, who will also educate the family and child on how to maintain the diet.